Good morning. So, Professor Della Santa gave a talk. Is it okay like here? That he's old enough to be a philosopher, and I cannot claim that thing. So I will bring you to the real life. It's more like, and my talk is more like an academic talk. In fact, I was communicated only 3 days ago, and I was not very much aware of this forum. So I will show, but anyway, nevertheless, I think you will like this talk because I'm giving a talk that what is happening, how genetics is integrating in medicine, in the clinical medicine, and how it is evolving, how it is transforming our life. So, I will give you a kind of a half an hour practical example from my own lab in Lausanne. So, genomic information that a few years ago there was an article in Nature that should it be treated like an X-ray, because when I have a disease, for example, you have a pulmonary disease, and you go to a doctor, you could take an X-ray, and then the doctor looks at your X-ray profile and then diagnose your disease. So our genetic information, can it be helpful for our, can it be used as a kind of X-ray for our life? So just before start, something like that. So this is these are single cells. So we are human, and we have different organs, and different organs, there are lots of cells. So you can see that in the top, you will see that there are 1, 2, 3, 4, 5. There are 5 cells in a cluster. And within each cell, you can see the red one, and that's the nucleus. And then below, there are individual cells. Just I'm showing you, as I told you, that I'm bringing you to the classroom. And this is a cell, single cell. And inside the cells, there are 23 pairs of chromosomes. And this chromosome consists of DNA. You can see that thing. And then, so this is the DNA, kind of looks like. There are 4 bases, and there are positive strands, and there are negative strands, and they're bind to each other. And then, so this is the A always has to be with T, and G always has to be with C. So this is the rule. And these, so inside the nucleus, there are chromosomes, and chromosomes has the DNA, and DNA makes the RNA, RNA makes the protein, and protein, that's what is functions inside our body. So this is the DNA sequence looks like. Then, this is like a completely puzzling thing. And variation in these DNAs, it can cause, it has have a different function. And changes in this DNA can cause different types of diseases, like you can see it here from the cancer to the heart disease to the disease in the eyes and to brain diseases. So this is a focus in the medicine for last 15, 20 years. So I will show you from the clinical point. So this is a chromosomes, 23 pairs of chromosome you can see inside a cell. And that has been used, still it is being used for diagnosing different disorders. Like you see that trisomy 21, and I think that you people are very much familiar with the Down syndrome patients, which I see a lot, and these are 2 Down syndrome babies, and what they happen is you see that these 21, they have, instead of 2, they have 3 chromosomes. So when a baby has 3 chromosomes, they have the Down syndrome. And then we also can diagnose these things in the amniotic fluid or in the cells like this. You can see there is called in situ hybridization, means there are signals. You can see that there are 3 signals for chromosome 21. So this is a new technology. So I'm taking you to the more clinical arena. Like how DNA inside our body, how the genetics can lead to the different types of disease. This is one example of a 1-month-old boy. He just had we had this patient a few months ago, and that he has a pacemaker implanted just at 3 days of life. And doctors didn't know, the cardiologists didn't know what is the cause, what could be the reason. So it came to our lab, and then we found that there is a defect in this small child in a particular gene called calmodulin gene. And because of this, that gene is very much functional in the heart, but not in other places. And because of the defect in that gene, this boy had these cardiac problem since his birth. And the parents are normal, and parents didn't have this defect. So again, this another disease. These are the families from here. You can see it from Saudi Arabia, because I do a lot of research in developing countries. And in this family, there are many sudden deaths. And this family came to me to discuss that why they have a sudden death, and doctors could not find out the cause. And you know that in Saudi Arabia, there are many consanguineous marriages, means the marriage inside the family. So we eventually found that there are some genes in this family which is defective and which is causing the disease and which is making the children die suddenly in that family. Apparently, the children are completely normal, but they die of sudden heart attack, sudden death. So we did a lot of counseling in this family. We found the gene, and now in this family, so we can do the prenatal counseling or prenatal. If the mother is pregnant, we can do the diagnosis beforehand whether the child will have the disease or not. So this is one of the very major advancement in the genetics. And this is another family, the similar type of family, that in this family there are a lot of abortions and a lot of miscarriages were going on. And even the child, when it is in the uterus, when it's in the intrauterine stage, the child had cardiac disorders. So eventually we found out what is the reason for that thing. So we are now offering counseling in this family so that there is no sudden death in this family due to this genetic defect. And this is another patient with a similar things. The mother, after the giving birth to a baby, and she had a cardiac arrest. This is also could be due to genetic defect. And another thing is for interest. You see that in this particular boy, so normally our heart is on the left side. In this boy, you can see the heart is in the right side. Okay, so that can happen. And in this type of defect, we found that there is a gene which is on the, deleted part of the gene, and that's why this boy's heart is on the right side. So could you please, this is an interesting case. Could you please, the video, please? Doesn't work. Looks like it doesn't work here. So anyway, this is another family. This is quite a bit sad things that two boys died in this family, and there was family was desperate to have another children, and there was no clue why this boy the fetus was dying, and then eventually we found that their mother is carrying a defect in a gene which is causing the disease, because you know that mother or the female has 2 X chromosomes, and the boys have 1 X and 1 Y. So these boys always getting the wrong, the defective X from the mother. Mother is completely normal, and this boy is always having the disease. They are dying several days after their birth. So in this case, we found the gene, and we saw that, and now we are counseling this family, and there is a child in that family who is normal, and we showed that mother is recently pregnant, and we did the analysis and showed that, okay, this boy is normal. He has the good X chromosome from the mother. So this is the way genetics is helping in our society. And this is another case of, you see, it came from Zurich, yes, it came from Zurich. It's genetics of kidney disease. You can see that there are lots of stone in the kidney. Here you can see that, and then we did the analysis for genetic defect, and you see that there is a gene defect, completely deleted in this case, and now in this family, we are offering more counseling or genetic analysis. And this is a family from Sri Lanka, came to me several months ago, and they were having a bit difficulty in diagnosis. You can see that in the in the boy, there is a kind of eczematous rash, and this boy had a kind of a stool with the blood, and they were a bit confused with the diagnosis. And then we did the diagnosis, and in this patient, there is again a gene which is defective and which is deleted in this patient. So now we are doing the family screening in this family and also in the unborn child, so to prevent this type of defect. And then genetic disease is not only to the heart disease or to the kidney disease. You can also see it here. The triplet repeat disease means there are some genes which is repeated in certain locations, and because of these things, people can have, like you see in the, I think you have seen many patients that who have the ataxia, means gait is they cannot, they were completely normal, but they have a kind of ataxic gait, and these people can have gene defective in the there are certain genes for these things, and they develop this disease over time. And these are the triplet repeat disease. And another one is the Fragile X syndrome, which is not very rare. It causes also mental retardation, and this is a thing that you can prevent these things. Like here, I can show you an example that usually mothers are normal, because again, this mother has 2 eggs, and when the wrong X or defective X comes to the boy, he has only 1 X, and he develops mental retardation. So we offer genetic counseling or antenatal counseling or antenatal genetic analysis in this type of families, so that they don't have any children with the mental disorder. So now we are coming to we are now transforming into the new era. Until now, I explained to you the diseases which are purely genetics that runs in the family. So now we are working more in a more different context, like a common diseases, like someone has a coronary heart disease, who has a disease in, let's say, heart attack at the age of 50 or 55. So it is not only genetics. Genetics plays some role, but also there is environment, there is food, there are a lot of things. So we are now working on that part all over the world. And now, until now, we used to do a genetic analysis 1 by 1 gene, but now we have the facilities that we can do genetic analysis, and we can screen the whole gene in our, we have in 3-4 days. But analysis is still a bit difficult, but it is possible to screen the whole gene. And that is bringing a new dimension into our, in the medicine. Like you know, the DNA defect, then you know the RNA defect, and there is how these DNAs or how these, there is a methylation problem is there. So when you combine all these things, then you can find a global scenario that what is happening and what is causing the disease. So this is leading us to a new direction of the disease mechanism. So, you know, again, this is an autistic disorder patients. So there are a lot of children. I originally come from Bangladesh, and recently when I go to Bangladesh, I see there are a lot of children. Mothers come to me that they have children with autism, and I never experienced that thing before. And a lot of autism, this happens due to the mutation and defect in genes. It's not a single gene. It can have multiple genes. Like here, you can see that the main gene is the master gene is in the middle, and there is a network of genes. So it can be single gene, but it's most likely it is speculated that is the multiple gene defect can cause this type of autism. So it is still an evolving field, and eventually I believe that there will be, at this moment, there is no clinical management or clinical treatment for the autistic children, but in future, I believe that there will be clinical treatment for this type of autistic patients. Just for your information, there is a common belief, or a lot of people think that genetic defects comes from the mother, which is not true. If you look at here, there is an article in Nature a few years ago, or 2-3 years ago, that is most of the genetic defects comes from the father. In the father's sperm, when the father is old, he has more defect in his sperm, and that comes to the child, and that's caused the disease. So it's not the mother mostly, it is mostly the father. So you have to, this is an important information. And now also we are going to another phase of like, as I showed you, the trisomy, the Down syndrome. So until now, we diagnose these patients by taking the blood from the child, or when the mother is pregnant, then we used to take the amniotic fluid or the other chorionic villus to diagnose this case. But now we can do the diagnosis in a different way, because the DNA from the fetus is found in the mother's blood. So we can take the mother's blood and we can do the diagnosis for these different genetic diseases, so which is an evolving, this is very new field. It is coming, it is evolving also. And another thing is that until now, like for example, you have a common cold, you have like a cold season, you have a flu, you go to the medicine, you have a flu, you go to the doctor, you get a antihistamine to block your cold, but everybody is getting the same medicine. Somebody is getting relieved of these symptoms in 3 days, and someone is not getting relieved at all. So now medicine is focusing more on individualized medicine. So you get a medicine based on your genetic background, and the other person is getting medicine based on the genetic background. So this is a new field is coming to the individualized medicine. And also for cancer treatment, like one example is here, is that someone has a cancer in the lung, and the particular type of cancer, and he or she is getting a same treatment. But we now see that with the same cancer, you can have a different type of genetic defect. So based on the defect, your treatment could be varied. So this is an evolving field in cancer. And then I show you another one, that this is a family came to me several years ago. So there are lots of sudden deaths in this family. And from Sudan, you can see that a lot of sudden deaths. And then eventually we found the gene and how it helps. And so now we screen the whole tribe, because in Saudi, in that place, there are a lot of intertribal marriages. So we know who is the carrier and who is not the carriers. In that case, we can say that, okay, please take this medication. We can prevent the sudden death. And then what we did, the stem cells. So we took the skin from one of the patients, and we made the stem cells, and from the stem cells, we made the cardiomyocytes. Maybe this is a cell. The cardiomyocytes means the heart cell. So can you start the video here or no? No, it doesn't work, okay. So you will see that this is a cell on the plate. On the plate means in the lab that this is contracting like a heart cell. So we made this heart cell from this patient, and now we are examining this, that what is the abnormality in this case, and now we will eventually treat different medications to, so this is one why I'm showing these things, is that how this field or how these stem cells are essential, that you can analyze the mechanism of the disease, and also like in future, like someone has a myocardial infarction, a lot of heart cells are necrosed or dead. So with the stem cells, you can make heart cells and put it there, and like a liver cirrhosis. Also, the liver is completely destroyed, so you can make liver cells outside. So this is the potential of the stem cells, but this will take quite some time, but we are proceeding toward that direction. So I conclude in this way that genetics is really an integral component in medicine, because people think that genetics is completely a research. It has no link to the clinic. It is not true. It is an integral component. And proper clinical diagnosis, preventive measures, and gene-based clinical management is available. And pre-symptomatic or prenatal genetic testing is offered in clinical practice. But most important thing is that genetics is leading us to a new dimension of personalized medicine or individualized medicine, and also toward gene-targeted therapy. And thank you very much for your attention.